In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E.
Half a day, everyone, and welcome to In Full Zoom. And this week, we're going to talk a little bit about the medical industry, which has been getting a lot of discussion over the past few weeks. But we want to focus on a new service that GRMC is going to be expanding on, minimal invasive surgery. And we have the perfect person to talk about that. She is Dr. Mariana Vigiola Cruz, who just arrived on island a short while ago, and she's the new expert in this field. Welcome to the show, Dr. Cruz.
Having me. Thank you. It's a pleasure being here.
Before we start talking about the new expanded surgery services, tell us a little bit about yourself. What's your background? How'd you come to Guam? That sort of stuff.
Yes, I grew up in Mexico, actually, and then I moved to the U.S. over 20 years ago now. So I've done all of my school and training in the U.S. I was in New Jersey for a portion of school, and then I was in Washington, D.C. for my residency, and then in New York City for my fellowship training. I came to Guam because my husband is an orthopedic surgeon with the Navy, and we were moved over here. I was very lucky to be able to find a job where I can practice what I really love to do, and also bring a new set of skills to expand the hospital's services on island.
Before you got here, what did you know about the medical care system on Guam?
Well, not much. I can't say I knew a whole lot about Guam in general, but certainly while discussing the position and the hospital's resources with the administration and my new partner here, I realized there were certainly a lot of ways in which we could expand the hospital's abilities, but also that there were many resources that were already being adequately used. And so it's been a really nice experience getting to see a very different side of medicine within the United States.
Okay, let's get into your specialty, minimally invasive surgery. First of all, can you explain exactly what that is?
Sure. So I'm a general surgeon. My residency training was in general surgery. After that, many people decide to do subspecialty training, and they can do fellowships in things like vascular surgery, colorectal surgery, thoracic surgery. I chose minimally invasive surgery, which is essentially an expansion of general surgery with advanced training in laparoscopic and robotic surgery. I personally had a lot of robotic surgery training and bariatric surgery training, as well as what we call foregut or upper abdomen type of surgery. The minimally invasive field is broad. Many different programs have the different things that they focus on. And generally, the main concept behind minimally invasive surgery is minimizing the collateral damage, if you were to think of it that way, that we create in doing an operation compared to the traditional way. So traditionally, if you had, for example, gallbladder problems, when we first did cholecystectomies or gallbladder removals, they would be done through a larger open incision in the abdomen, right, overlying the gallbladder. Today, the standard of care in most places is to do them with minimally invasive techniques, meaning we place tubes essentially into the abdomen that we call ports that allow us to insert very thin instruments. We place a source of gas or CO2 that allows us to have room to work, and we put a camera with light, and then we use these very thin instruments to do the work that essentially previously we would have done with larger instruments being held in our hands. Now these are longer instruments that the handles still are in our hands, but the working part of the instrument is actually in the body. And so this allows us to do a lot of work in the abdomen without having to open a large incision to get there.
Yeah, and the fact that the incisions are much smaller, that makes it a lot safer?
It doesn't necessarily make it a lot safer, because the safety is really about the surgeon who's performing the operation and the patient, and that's tailored individually to every situation. But there are certain benefits, of course, to minimally invasive surgery, such as faster recovery because there is generally less pain associated with smaller incisions and a minimally invasive operation. There are often fewer long-term consequences to these to having small incisions because there's less scar tissue that forms on the outside and on the inside of the body. Similarly, there is lower risk of hernia, meaning a weakening of the abdominal wall that then can cause a protrusion and many long-term side effects like those. But the way that procedures were eventually evolved into laparoscopy or minimally invasive surgery made it such that both ways were still safe. It's just we think this is certainly a better way to do things that can be done either way.
We're going to take a short break and be back with more In Full Zoom right after this.
In Full Zoom is presented by Calvo Enterprises Inc. and IT&E. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. In Full Zoom is presented by Calvo Enterprises Inc. and IT&E.
Yeah. How would I know you've been here just a short time, but how would you compare Guam's resources? Because we are a small island with, a smaller scale than maybe New York, where you practiced before. How would you compare the medical resources here to other places where you worked?
Certainly, it's a very different island than Manhattan, for instance. I think the resources are more limited, of course. It's we only have 2 civilian hospitals and 1 military hospital on the island. And in general, I think bringing supplies to a location that is so remote is a challenge, but also bringing providers that are skilled in various surgical fields and medical fields as well is challenging. And so for that reason, we just don't have the same resources that we would on the mainland. But I think in that same vein, we also can learn to expand our skills and use a little creativity and using the resources that we do have. And I think that's always positive.
If you were to recommend to our local leaders what sort of resources to bring first, if there was a priority list, what would be your recommendations? What do we need most here, given the type of diseases or ailments that the people of Guam suffer from?
I'm new here, right? So I'm just starting to learn all of these things, but I think most immediately primary care. It's where medicine really should start and where prevention really should start. We're treating patients with advanced diseases and complications caused by things like hypertension, diabetes, high cholesterol that have gone untreated for decades in a lot of people. We have patients that come in with strokes who are very young. If we had better primary care, maybe we wouldn't have to treat patients with such advanced disease early in their lives. And our role as surgeons would be a little bit different. But certainly, I think starting with primary care would be hugely beneficial in the long term. I think funding of really all of the hospitals is a challenge, just like in most places. I couldn't tell you specifically which areas of the hospital need that most, but certainly funding to have more materials, to have more specialty providers, and certainly more nurses would be great.
Yeah. If I hear you correctly, I think you're saying earlier intervention so that they don't necessarily have to get to you with very serious cases. Yeah.
Exactly.
Yeah. There are plans to build, as you probably know, a new medical campus that would include both a new GMH and a new public health facility and a behavioral health facility, all in one big campus, as I said. What are your thoughts on that?
I honestly don't know much about it, being that I've only been at GRMC for a couple of weeks. I think if the ability to expand is there and we are capable of building something that will be helpful to the community, I think that's great, but I honestly don't know a lot of the details about it.
Yeah. In the couple of weeks that you've been here, can you tell us a little bit about, without disclosing any HIPAA violations or anything like that, some of the procedures that you've been able to do and, the outcomes?
Yeah, for now, I've been covering essentially the call in the emergency room, and so it's whatever usually comes in through the door, and people generally have problems with their appendix or their gallbladder. We've treated, unfortunately, a few advanced colon cancers, which again, patients that may have had a colonoscopy at the age of 50 routinely would potentially not end up here with an advanced colon disease like that. So we've certainly seen that a lot lately. Patients with diabetic wounds, wounds on the lower extremities related to uncontrolled diabetes, that sort of thing. That's mostly what I've been keeping busy with the last few weeks. And certainly my goal would be in my elective practice to focus on mostly abdominal surgery, to do minimally invasive cases, as well as hernia or abdominal wall work. Down the line, we are also looking at expanding our bariatric capabilities, meaning starting to perform weight loss surgery. That has been done on island before, but we don't have an established program. I think that could be hugely beneficial to the community as well, and certainly something that could keep us very busy.
In Full Zoom will continue in just a moment.
In Full Zoom is presented by Calvo Enterprises Inc. and IT&E. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. In Full Zoom is presented by Calvo Enterprises Inc. and IT&E.
Yeah, can you elaborate on that? The obesity, that has afflicted the island. Unfortunately, that there's a lot of truth to that. What sort of can you elaborate on what laparoscopic surgery is and how that can benefit a patient who is, very obese?
So laparoscopic surgery in general is essentially a different word for what I was describing earlier with minimally invasive surgery. So the laparoscope is a camera that we use to perform these operations, whether it be gallbladder, an appendix, as a hernia, or weight loss surgery. Weight loss surgery is also called bariatric surgery. And essentially that is used to treat obesity, but it also is used to treat other problems like diabetes and hypertension. The two main operations that are done on the mainland today are the sleeve gastrectomy, or the stomach stapling, as some people might know it, where the size of the stomach is significantly reduced to about 20% of the original size. And that's to restrict the amount of food that can be eaten at once, but also to alter the sort of hormonal balance of the body and make it easier to lose weight, but also easier to control problems like diabetes and high blood pressure. The other operation that's commonly done, and patients have to be selected for one or the other generally, depending on the patient, is a gastric bypass, or just known as bypass, where the stomach is made smaller where the food actually enters, but also the intestines are rerouted to prevent absorption of some of the nutrients. And so with both of those approaches, you certainly can see significant weight loss, improvements in diabetes and high blood pressure in those specific patients. So certainly something that we could implement and benefit long term.
And that's something that patients previously have had to go off island to get?
I think generally that was what was done. And we have another private surgeon who has performed a handful of these operations on the island. But the benefit of bringing a trained bariatric surgeon like myself is that we could make this higher volume program that could potentially eventually be accredited by some of the national societies.
Yeah, one of the things that I wanted to ask you about is that I think when GRMC was first conceived, I think the idea was not so much to be in competition with GMH, but to be complementary to it, because there were a lot of services that GMH could not provide or was not providing that maybe a new hospital could focus on, so that there would be more breadth to the medical services that were provided on Guam. Do you think that's the way it should be?
I think so. It's a small island, and so to optimize our resources and to optimize care in general, I think the ideal thing would be to have a complementary relationship. Certainly, when our goal is the same, we should not be competing for business when we're also trying to take care of people.
Yeah, I did want to ask you, and I don't know how much you want to delve into this, but the most recent controversy has been over medical malpractice insurance. A bill has been introduced in the legislature that a lot of the medical community has been generally opposed to, although they do see the need for some sort of legislation to ensure that people who can't afford to sue, if you will, for a bad outcome, that there is an opportunity for them. Do you have any thoughts on that?
And again, being here brand new, this is something I'm learning about. My only comment on that is that obviously the law would be there to protect patients, but ultimately, I think just as considering the welfare of patients, we have to consider the good intentions of the physicians and the resources that are available, because it's not the easiest place to practice, and we don't have unlimited resources and unlimited providers. And so just like we look out for patient wellness in creating laws like that, we have to make sure that we're doing that within an environment that allows for physicians to still take care of patients to the best of their ability.
Yeah, well said. And I think that really reflects what most of the physicians have been trying to get across, that there is concern about, those patients, but also about the overall delivery of healthcare on Guam. How can we kind of make find some sort of middle ground? Stay with us. We'll be right back.
In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E. GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information. In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E.
I do want to go back to you mentioned robotics, which I think is really fascinating. I don't know if we have that capability here, but could you tell us a little bit more about robotics, and is that going to be the wave of the future that we're going to be operated on by robots?
You're not operated on by robots. You're operated on by a surgeon who uses operate. So the best way to think of it is to not think of it as a new entity that's going to do your operation, but it's really an instrument that is very, very specialized and truly an amazing tool in the right hands. I do think is the wave of the future. We do not have that technology on island. It takes a lot of infrastructure and funds and maintenance to have something like that. It's just not something that we're ready for here yet. Will it be eventually here? I hope so. But certainly on the mainland, a lot of my elective practice was robotics, and it truly changes the ability of surgeons to do things independently through small incisions in places anatomically in the body where it generally would be very challenging to perform certain specialized operations.
Well, we do have our local leaders considering a new hospital and all of the equipment that would have to go into the hospital. So you can go ahead and make a pitch for it. Why should they?
Say that one more time.
Yeah, well, I was saying that we have the local leaders considering right now to really build a new hospital and would have to fill it with the equipment, that's necessary to carry out its function. So this is an opportunity for you to pitch to them why we should get robotics here and why it would be good for the people of Guam, which is what they want to do with this hospital.
Yeah, it's hard because with robotics, you also need surgeons that use the instruments to be able to make it a sustainable financial commitment. So, unless you had a good handful of surgeons that were willing to use it, it would be a hard thing to pitch, but it's certainly something to think about.
All right. So we did want to get your perspective as a new healthcare provider to the island. We've had a lot of discussion over the past few weeks of the industry as it has been and what's been some of the challenges. So wanted to give you an opportunity as we got the final minutes to just say something to the viewers. Your final thoughts.
Sure. First of all, I feel extraordinarily lucky to be here and be welcomed to take care of the community here. There are a lot of challenges that providers face in dealing with relatively limited resources. But one of the things that I've noticed from day one is how appreciative patients really are to be able to be taken care of and have a chance to get better and heal. And that's not something I've experienced every place I've been. And I truly appreciate how much that means to the people of Guam.
Well, we certainly welcome you to Guam, and I'm sure your patients will appreciate that you're here. Dr. Mariana Vigiola Cruz is our guest this week from the Guam Regional Medical City. Thank you for joining us.
Thank you for having me. It's a pleasure.
I'm Nestor Licanto. Thanks for watching, everyone. We'll see you again next week on In Full Zoom.
In Full Zoom is presented by Calvo Enterprises, Inc. and IT&E.